A journey of 1,000 miles begins with the first step. The Pharmaceutical Association of Malaysia was first registered on the 19th of June 1972 as Malaysian Pharmaceutical Trade and Manufacturers Association (PhAMA). From 8 founding members, the association now has 43 members comprising iconic multinational pharmaceutical companies. The association has grown by leaps and bounds in the last 5 decades, establishing its position as the point of reference for pharmaceutical-related matters in the country. Through the years, one thing remains constant: the drive to provide access to innovative medicine to Malaysians. From the start, PhAMA recognized that this cannot be achieved alone. Today, PhAMA is affiliated to the International Federation of Pharmaceutical Manufacturers Association, Pharmaceutical Research and Manufacturers of America, Global Self-Care Federation, Asia-Pacific Economic Cooperation, and more. With safety and quality assurance serving as the cornerstones of PhAMA, the founding members emphasize the importance of principles, ethical practices, and strong regulatory guidelines to ensure quality and sustainable supply of medicines. Stringent regulatory controls protected inferior and imitation products from infiltrating the market, and developed a strong knowledge sector that is evidence-based and backed by science and driven by innovation. To ensure ethical marketing of pharmaceutical products in Malaysia, PhAMA Code of Ethics was first mooted in the 1970s and officially formalized in 1979. Capacity building and career progression were also key focus areas from the start. In the last 50 years, PhAMA has invested substantially in training for key stakeholders, including government officials, members companies, and others. To enhance professional standards within the industry, various programs were conducted through the years. Today, PhAMA is focused on 4 key pillars: advocacy, industry support, capability building, and strategic partnerships, working hand in hand with important key stakeholders such as the Malaysian Ministry of Health, Ministry of Human Resources, Ministry of Finance, and others. PhAMA spares no efforts providing support such as evidence-based data, internally recognized scientific studies, and best practices around the world. When Malaysia was struck by the COVID-19 pandemic, PhAMA worked side by side with the Ministry of Health, providing financial assistance and personal protective equipment and sanitizers valued at over 5.5 million ringgit to medical frontliners. PhAMA members were also at the forefront of the national COVID vaccination program, where over 72 million doses of vaccines were safely administered to the population across over 2,500 vaccine centers. This achievement placed Malaysia in the top 10 highest rates of COVID-19 vaccination worldwide. In breaking new frontiers, PhAMA reaffirms our commitment to bringing innovative medicines to Malaysia through the Ministry of Health's Health Reforms White Paper and finding the new ways towards sustainable healthcare financing. What lies ahead for PhAMA: strengthening public-private partnerships and capitalizing on collective synergies towards a healthier Malaysia. Thank you for being part of our journey in the last 5 decades. Join us in our next 50 years towards healthcare excellence.